What is a disturbing medical fact that not many people know? Story 1. There are so many wild things living in the microbiome of a human skin. Demodex are a great example, little mites that live near human hair follicles. They look horrific and they feed off of sebum, sweat, dead skin, etc. Many things are localized too. The things living in your eyelash follicles are not the same as the ones living on your elbows. We're a whole universe. And even our skin is colonized by bizarre little crappers. Story 2. Not a human example, probably. But sometimes cows, goats, and other animals get pregnant. But instead of giving birth to a normal lamb slash kid slash calf, it gives birth to an amorphous globosus, a spherical mass of flesh with an outer layer of skin with hair or fur, and the inside a jumbled mess of guts and tissues and sometimes teeth. They never have brains or spinal cords, though, so they're always stillborn and non viable. Story 3. The first doctor to suggest hand washing before surgery was laughed at repeatedly by his colleagues. Much worse than that, actually. Some doctors were offended at the suggestion that they should wash their hands and mocked him for it. In 1865, the increasingly outspoken Semmelweis allegedly suffered a nervous breakdown and was committed to an asylum by his colleagues. In the asylum, he was beaten by the guards. He died 14 days later from a gangrenous wound on his right hand that may have been caused by the beating. Story 4. The health of your teeth, or lack thereof, can cause heart disease. The bacteria that infect the gums and cause gingivitis and periodontitis also travel to blood vessels elsewhere in the body, where they cause blood vessel inflammation and damage. If you are diabetic and don't know it, or do, but have problems controlling your sugars, it can severely harm your teeth. On the flip side, having bad teeth can severely affect your blood glucose as a diabetic. It can become a crappy cycle, and yes, mentioned earlier, but if you get an infected tooth, that infection can travel to the brain or blood very fast. And yet, teeth are still considered luxury bones, with maintenance, cleaning, and dental care hardly ever being covered by insurance. Story 5. Humans have both light meat and dark meat due to type 1A and type 2B muscle fibers. However, humans are lean and not very calorie dense. So if you're already starving, cannibalism doesn't do much good. Actually, it does. You just have to crack the bones and eat the bone marrow first, because that has enough fat for you to be able to extract nutrients from the lean meat. The problem isn't that human meat is lean. The problem is that when you're starving, at some point you have so little fat, you and whoever you plan to eat, left in you, that you don't even have enough to use to absorb stuff from whatever food you can get your hands on. But bone marrow still has fat in it. Even if literally every other fat store in your body doesn't, it's one of the last fat stores to go because you need it so much. And I'm pretty sure you starve to death long before you run out of bone marrow. So just crack open a bone one with the boys, and cannibalism will be fine. Story 6. Not necessarily a medical fact, but a reality check. Doctors don't have everything figured out. They are just human like the rest of us. Just like how us software developers search Google to troubleshoot something when we are stuck, they do too. Shows like Doctor House portray doctors as this infallible walking medical encyclopedia. It's all fiction. So always be open to getting a second opinion if something isn't working. Story 7. That doctors don't know everything, and you can go years without getting a diagnosis while being in unspeakable pain. I'm going through this right now. 19 months of this. I can't handle another few more. How can something that hurts this bad and feel like a broken rib not show up or be known after almost 2 years of tests? At the end of my rope here, try to get an ultrasound. I had a mystery injury which turned out to be a dislocated rib, which caught in my abdominal wall, and it would dislocate when I laughed or coughed. You could see and feel it. Everybody put me in a rib brace and said, wait, and wait some more. It forced me to change my college major, screwed up career plans. 3 years later, it wasn't fixed, and DRs still shrugged. My mom found a friend of a friend who was a surgeon, and he had to get special permission to take an ultrasound and confirm there was an issue to operate on. He confirmed it was a surgical need and cut off 1.5 inches of one of my ribs and meshed the injury it was causing to my abdominal wall. Fixed it. So basically, try to get an ultrasound. Story 8, I just learned about SJS, where you get an adverse reaction to a medication by your skin falling off. It happens seemingly at random, too, but some medications are more prone to cause it. Fun stuff. Story 9, the truth about HeLa cells. These cells grow and divide constantly and are used in all sorts of medical research to discover cures for cancer and other diseases. They were originally harvested from a woman named Henrietta Lacks, who had cervical cancer that was fatal. She died in 1951. Her family didn't know that her cells were even being used until recently. These cells were basically stolen from Henrietta by a doctor, and he made millions from them. and Henrietta's family never knew. Once they found out, they finally settled with a biotech company for an undisclosed amount. This woman has basically saved so many of us, and we all owe her so much. Story 10. You currently have a large number of arachnids on your face. It's pretty common knowledge at this point that we all have little mites crawling all over our faces and hair all the time. But I don't think most people know that mites are arachnids. Since they have a very short life cycle, a couple weeks, that means a bunch of those arachnids are currently screwing, a bunch of others are pooping, and a bunch of others are dying. Again, and I cannot stress this enough, this is all happening on your face right now. Story 11. Spontaneous human combustion. Those who combust tend to have a high percentage of body fat, a condition like diabetic neuropathy, polyester clothing and/or furniture, and are usually smokers, fall asleep sitting by the fire, or smoking a cigarette. Ember sets clothing, furniture on fire, subcutaneous fat melts and burns. They don't feel it because of meds/booze/narcolepsy/neuropathy, and the person burns so fast they don't wake up. Story 12. I worked at a cancer hospital on a floor that did surgeries. There were many times that the patient was wheeled up after being in the OR. They wake up, the surgeon comes back and tells them that they couldn't do any surgery because the tumor is inoperable. As much as they try to diagnose and do all sorts of imaging beforehand, there is no way to tell exactly what's going on until you are cut open and they can physically see everything. An example of this is someone that has a stomach tumor, but when they go in, they find on the backside that the tumor is growing into the aorta, which would be hugely life-threatening to remove. Things like that. It's heartbreaking because these people may have gone through months and months of getting testing, chemo, radiation, taking time off work, grieving, being physically out of it, their families helping and rooting for them. They go in early on their op day, anxious yet excited that this might be it. Get put under, the doc opens them up, starts poking around, maybe removing some stuff they can, but then they find something that was impossible to visualize before. And then to imagine it's the afternoon, you're waking up in a room, your first thoughts are, I made it, they did the thing, just to have the doctor come back and break terrible news to you. Story 13. The classic presentation of appendicitis, abdominal pain moving from the center to the right side, happens less than 50% of the time. 2 weeks ago, my son's stomach started to hurt. We let him take the day off school. At no time did the pain move. It just stayed in the center of the abdomen. The next morning, the pain had gotten very bad. I touched his stomach, and it was hard. He also said it hurt worse when I stopped pressing than when I was. I woke my husband up and said, take him to the ER now. I've got a really bad feeling. When the surgeons got in there, his appendix had just started to perforate, but hadn't burst. Had we waited longer, things could have gotten very bad. He had a couple minor complications, but got out in a week and is back to normal again. Of course, we had major parental guilt, but the doctor said, you were going off the information you'd been told before and didn't know that it's fault. You knew enough to listen to your intuition and bring him in. Story 14. Surgeries have been practiced and effective for thousands of years. Trephination for head trauma, rhinoplasty, foreskin recovery all predate Christ. Until the invention of randomized controlled trials, medicines were either toxic and useless or used for a handful of specific conditions. These are pain, constipation, and sleeplessness. This is why surgeons were respected, but physicians, medical men, were judged as unprofessional hacks. Story 15. Contrary to medical shows and layman knowledge, when a patient flatlines and goes into cardiac arrest, the average odds of making a full recovery if successfully resuscitated are 10% in ideal conditions. Arrest is witnessed, appropriate personnel respond with CPR immediately, ACLS algorithm followed appropriately, etc. These odds drop precipitously, and even when patients are brought back, there are still a whole host of other problems that can arise as a result of the cardiac arrest, such as anoxic brain injuries, AKI, and many others. Story 16. I found out that some people aren't meant to have face piercings, but their body rejects it. I was one of those people and got snake bites. The back of my lip healed over the piercing, and it got stuck. I have to get the back of my lip cut out to get the piercing out. 15-year-old me was being hard-headed to just take them out in the first place. I don't think this works how you think it does. Rejection of a piercing is when the piercing is done too close to the edge of the lip of tissue, it's pierced through, and it slowly starts migrating closer and closer to the edge until the body pushes it out or you take it out. What happened to you is that the bar was probably too short, and your lip swelled so much that it started growing over the back of the bar. This is called embedding. Story 17. Bloodletting, leeches, and trepanation are still effective treatments for some conditions. For example, bloodletting is beneficial to people with significant hypertension, high blood pressure, for the simple fact that it reduces blood volume overall, reducing blood pressure. For it to be effective, you need to lose about 3 pints, which is way more than most people give at the blood bank. It will take the body 3 to 4 weeks to replenish that blood. So in that time, BP is measurably lower. Some people are actually prescribed a 3 to 4 pint withdrawal for this reason. But instead of wasting the blood, you may as well have the blood bank take it, so someone else can benefit. Although it has some risks, those risks are less than the long-term consumption of blood thinners and diuretics. Most people with HBP get hydrochlorothiazide to reduce blood volume. But long-term, this starts to mess with your ability to metabolize calcium and potassium, leading to muscle problems, weakness, and cramps. Simply bleeding out a few pints of blood is faster and has less side effects and lasts several weeks. They call it phlebotomy, but really .it quote s good old bloodletting. Leeches are still used in several cases. They have a natural chemical that stops clotting, which is useful post-surgery. They are also used in cases of saving replanted fingers, reattaching after being severed, and in some post-plastic surgeries to prevent venous congestion. In trepanation, they call it craniotomy now, but basically making a hole in the head to relieve pressure, say from encephalitis. Story 18. That 1 in 2 or 3 people will get cancer stat is the population average. That doesn't mean in an extended family of, say, 30 people like mine, grandparents, parents, aunts, uncles, and cousins, that 10 or 15 of us will get cancer. It means that potentially 1 or 2 of us get cancer, but another extended family of 30 lose 25 to cancer. Averages out to that 1 in 2 or 3 stat. Thankfully, it seems my extended family is the former, rather than the latter so far. Yet I know of entire families nearly wiped out by cancer before old age had a chance to take them. Story 19. Necrotizing fasciitis. Past just sounding creepy, this bacterial infection will cause your soft tissue to rot while you're still alive. Although it's rare, between 700 1,500 cases are reported each year in the United States alone, and up to 20% of these infections are fatal. It can enter through any abrasion and will rapidly destroy skin, muscle, and fat. At first, it just feels kind of like a flu, with fever, nausea, the like. After 3 or 4 days, the symptoms will get worse, often including discoloration and swelling of the infected area. After 4 and 5 days, it will just get even worse. At that time, the symptoms will become critical, including toxic shock and unconsciousness. This infection can lead to sepsis, organ failure, and death. Fun stuff. Story 20. Your vocal cords and the muscles around them can decide they don't want to move anymore. It's called muscle tension dysphonia, and I went in a lovely infection we all know about, from speaking normally one day to sounding like a pack-an-hour smoker the next. It's been over 2 years, and I'm starting to be told that I may have to accept that I'll never speak normally again. It's just like, excuse me, body, who gave you permission to stop working? I need those muscles. Ironically, one of my favorite singers contracted the same condition. It must be worse for him. At least I don't make money off my voice. Story 21. Measles is no joke. Yes, the rash is bad, but it also wreaks havoc on the immune system. The measles virus can deplete previously acquired immune memory by killing cells that make antibodies, and thus weakens the immune system, which can cause deaths from other diseases. Suppression of the immune system by measles lasts about 2 years and has been epidemiologically implicated in up to 90% of childhood deaths in third world countries, and historically may have caused rather more deaths in the United States, the UK, and Denmark than were directly caused by measles. Story 22. If you suspect someone has an undiagnosed mental illness, expect mental illness to be checked out second to last. Most medical personnel won't just diagnose anyone with any mental illness without going to all the likely physical health first. This is actually a good thing, because there are a host of physical health problems that can mimic mental illness. I remember watching an episode of Untold Stories of the ER, where a guy was put on medication for what many thought was psychosis. However, the guy's manic episodes were still happening. So, they did other tests and opted to give him anticonvulsants after suspecting that he was having seizures. After that, the guy's illness subsided. Another episode, a woman was brought in for psychosis, which turns out to be a side effect of medication given to her weeks prior to treat a bacterial infection after reviewing her past medical records. Currently, in my case, there are talks about adjusting my selective serotonin reuptake inhibitors, which I've been taking for years, to keep my depression in check. The main reason was due to my Hashimoto's disease having similar symptoms and the likelihood of having endometriosis. Yes, I asked about it as I wasn't sure if SSRI interfered with the hormonal medication. It's too risky to simply go cold turkey on SSRI. Looking back at my high school years when many noticed I wasn't mentally all there, it was likely they didn't have any clue to check for hormonal problems as I was a teenager. I didn't get any of the current diagnosis until I was in my 20s. I'm currently in my late 30s. Luckily, the doctors I went to hold off the SSRI and hormonal treatment until I was an adult because most won't give such to children willingly, as the brain is still developing. Story 23. Rabies is transmitted through the nervous system. That means that an infected animal bite doesn't even need to draw blood to infect you. Most people who get it from bats don't even know that they were bitten. Bats have teeny little teeth that don't penetrate all the layers of the skin, just deep enough that the virus can get to a nerve. The good news is that the post-exposure vaccine is effective if you get it right away. Story 24. Nurse and midwife here. I wish people understood that if they are receiving treatment for a condition, they still have that condition. Case in point, if you're taking medication for something, you aren't suddenly free of that disease. Your blood pressure meds are maintaining a normal blood pressure because you have the condition of high blood pressure. Your insulin is maintaining your blood sugars because you have diabetes. Sounds simple, but amazing how much people tell us they have no conditions but are on 1,000 medications that tell a different story. Story 25. Not a doctor, but something a doctor told me when the incident occurred. Girls, if you get excruciating cramps at the time of your period, and it feels much worse than it actually is, go to a doctor. When I was 13, I had already been confirmed to have an ovarian cyst, and it made it very painful for me during my periods to the point where I had passed out from the pain of it once. However, at one point, it felt much worse than it typically did, and I blew it off as being because of my period. It turned out my appendix was bursting. The doctor told me a lot of women blow off period cramps because doctors tend to do the same. Don't. It almost meant life or death for me. Story 26. Doctor here. Don't stop your medications by yourself. Just don't, no matter how good you feel. Patients stop antibiotics and relapse. So many resistant TB cases here. Stop taking insulin and come with DKA. Stop taking antihypertensives and get a stroke. Don't stop any drug unless cleared prior with your doctor. Most of the diseases can only be managed. They can't really be cured. If you have diabetes, get sugar levels tested at least once a month. Don't ignore it. Don't mix alcohol and antidepressants. Also, no matter how bad it is, we have seen worse. Don't be ashamed. Pulling out doesn't mean she won't get pregnant. Precautions has too. Last, if you see anyone vomiting and lost conscious, turn them to their side. Less chances of it entering lungs. Story 27. Clinical psychologist here. If you need mental health treatment, try your local college campuses. Oftentimes there are training clinics, supervised by some of the best clinicians around. Most will provide a generous sliding fee scale. Treatment works, especially for sleep problems, depression, anxiety, PTSD, etc. Also, do not ignore mental health problems in your children or adolescents, including when you are concerned about substance use. Early intervention works best, and if you wait until they are 18, they may not get treatment for another decade because they refuse to go in until they mature in their late 20 AEs. So if your child or adolescent is showing signs of a mood or anxiety disorder, cutting, struggling with ADHD, and is using drugs regularly, weekly or more, and you are concerned, consider an intake assessment with a licensed psychologist. Story 28. If you want to keep hands/fingers/upper limbs intact, do not punch a wall, car door, guy in the face, his brick, etc. You will end up with a boxer's fracture or a break of your fifth metacarpal bone. Most of the time, everyone will know you were drunk when it happened, and it's not comfortable or fun. Do not reach into the chute of a running snowblower, even if it's stopped because something is stuck in there. Do not attempt to fix your chain-driven garage door opener by putting your fingers in the track and asking your wife to hit the button. Do not reach into an auger at work trying to retrieve your safety glove that just fell in there. Do not hold on to something at work that winches rope. If you have a wound on your hand/fingers/arm and it is oozing something that looks green, yellow, white, or pink, go to the doctor and have it looked at. You may save yourself from an amputation. Source: I'm an RN at an orthopedic surgery center. All of these things have happened numerous times. And yes, archaic as it seems, sometimes people have to get fingers or even hands amputated in this day and age because they ignored an infection. Story 29. Losing weight. When you didn't really try to lose weight is cancer until proven otherwise. People ignore this sign so often. And when we finally make a diagnosis, it turns out they noticed the weight loss months ago and could have been picked up earlier. If you lose more than 5% of your body weight and didn't try, see a doctor, even if you're young. Make an advanced healthcare directive. I work in the ICU. We can essentially keep you alive on life support indefinitely as a vegetable. Nobody wants that to happen to them, so make sure it doesn't happen to you. At some point in your life, you'll probably have a colonoscopy. Most people have one. Nobody admits they had it. Don't be embarrassed by it. Don't smoke. Eat crap, drink alcohols, skip exercise. Never go outside, binge TV, but just don't smoke. People always talk about lung cancer as the reason not to, but YouTube COPD, the ones who don't die of lung cancer, die a slow and drawn-out death where they essentially get more and more breathless over about 10 years. It's horrible, and unlike lung cancer, is near guaranteed to happen to lifelong smokers. If I was a smoker, I'd rather get lung cancer and die quickly than face COPD.